Welcome back. Today's topic, type 2 hypersensitivity. As we know, it is immediate hypersensitivity. That's why it is humoral hypersensitivity. It is antibody mediated. The main antibody that plays a role here is IgG. To a certain extent, IgM can also induce this. So what is the mechanism? How does this work? So first of all, we have to understand that just like any hypersensitivity, you require twice exposure, 2 times exposure of antigen minimum. So whenever first time antigen comes into contact with the body, we have APCs which engulf this antigen, present it to CD4 T cells. CD4 T cells analyze this and stimulate B cells and convert them into plasma cells to make IgM and IgG against that antigen. Okay. Once this IgM and IgG is formed, now what? These antibodies, especially IgG, they remain lifelong in that person's body. And whenever that second time that allergen or antigen comes into contact with the body, then there are two main mechanisms by which this hypersensitivity will happen. The first is complement dependent cytotoxicity, that is known as CDC. Here, the Fc portion of the antigen is free because antibody will bind to the target pathogen. So your bacteria or whatever microorganism is there, antibody are already produced against it because this has come second time. So antibody will go and bind to the antigens on surface of that pathogens. And now we know from our complement lecture that once antibody is bound to antigen, the classical complement pathway strikes in. Your C1q will go there, C1r, S, and entire classical complement cascade will be there, resulting in MAC formation. So your membrane attack complex, that is C5 to C9, will get inserted into these target cells. And what is the function of MAC? Membrane attack. So its cell membrane will be gone, and that will lead to cell lysis and cell death will happen. So this is the complement dependent reaction. So complement dependent cytotoxicity. Okay. So various example I can give you in this CDC is ABO incompatibility or transfusion reactions, autoimmune hemolytic anemias, drug-induced hemolytic anemias, pemphigus vulgaris, RH incompatibility or erythroblastoma fetalis are example of type 2 hypersensitivity which are CDC mediated. Okay. Is there any other mechanism? Yes. Antibody dependent cellular cytotoxicity. Now we have to understand that there are three cells which play a major role here, that is natural killer cell, eosinophil, and macrophages. So what happens is these cells have Fc receptor, and obviously antibody will go and bind to the target antigen, but its Fc portion is free. So this will attract this cell, and these cells will go and bind to this antibody with this Fc receptor, and these effector cells will now either do phagocytosis of this pathogen, or they release some chemicals in case of NK cell, that is granzyme and perforins, and they will try to kill this target cell. So either way, either ADCC or your CDC, the cell will die, right? So this is type 2 hypersensitivity. Here the cell is killed. Okay, there are other variations of type 2 hypersensitivity which I have included in type 5 and type 6, in which cell is not killed but its function is altered. Okay, so we will talk when we will talk about that at that point of time. So stay tuned for the more videos on our channel regarding hypersensitivity. So in next video I will talk about type 3 hypersensitivity.